Good afternoon. My name is Loira Rodriguez Muñoz. I am a clinical psychology student at Carlos Albizu University PhD program. This project's principal investigator is Dr. Cristina Velázquez from the Institute of Neurobiology. The project's topic is about the correlation between adverse childhood experiences and alcohol use among college students in Puerto Rico. Our project's hypothesis states that adverse childhood experiences are a direct predictor of excessive alcohol use in young adults within the endogenous population of Puerto Rico. In other words, we want to analyze a relationship between in-island Puerto Rican substance use and adverse childhood experiences, a type of trauma. This type of study in Puerto Rican population has not been done comprehensively. Furthermore, there is no informed prevention and government policy to ensure the necessary resources to address current and future problems related to alcohol use or substance use caused by trauma. According to the American Psychiatric Association's Diagnostic and Statistical Manual of Mental Disorders, or by its known acronym, the DSM5, defines alcohol use disorders as problematic drinking patterns that causes clinically significant distress. Under its criteria A, there's a list of symptoms that include persistent need for alcohol, excessive time dedicated to alcohol engagement, ignoring personal responsibilities, social problems, development of alcohol tolerance, among others. There's a total of 11 symptoms listed. However, only 2 have to be identified by the clinician, and they must persist for the past 12 months in order to be diagnosed. Disorder severity is characterized by the number of identified symptoms varying to mild, from 2 to 3 symptoms, to severe, with 6 or more symptoms. Cayetano published a paper about alcohol use disorder prevalence in Puerto Rico. Particularly, they found that the lifetime prevalence of DSM-5 alcohol use disorder was about 2 times higher among men than among women. Then, Cayetano compared the observed rate of lifetime alcohol use disorders reported in Puerto Rican sample with Grant's U.S. mainland general population. The 38% of men reported in the Puerto Rican sample did not differ from the 36% of men reported in the U.S. mainland sample. However, according to Cayetano et al., the rate for women appears to be higher on the U.S. mainland than in Puerto Rico, which was a contrasting 23% versus a 16%. In the end, we want to observe these differences and tendencies as directly related to ACE exposure. Our second variable are adverse childhood experiences, which would be a set of negative events prior to the individual's 18 years old that determine possible development of adulthood risk factors, according to Felitti et al. Felitti describes 2 major categories that define adverse childhood experiences. The first one is child abuse, that includes emotional, physical, and sexual. The second one is household dysfunction, with topics such as criminal activity, substance abuse, mental illnesses, and domestic violence. As we can see in the image, early adversity has lasting impacts. For example, maladaptive behaviors developed by ACE exposure includes alcohol, drug abuse, and unsafe sex. These risky behaviors can cause long-term health complications such as diabetes, cancer, obesity, and STDs. Furthermore, other outcomes include unequal educational and career opportunities, an increase in mental illnesses and violence. Particularly, we highlight the increase in domestic violence that has been identified since the pandemic started, a clear reflection of the prevalence of household dysfunction. In a more neurobiological approach, stress in healthy adults is essential for survival. For example, before taking a big test, or if you have to speak in public, you get this rush of stress that helps you adapt and prepare for that event. However, excessive amounts of stress can be harmful. When exposed to a negative stimulus such as an adverse childhood experience, it degenerates to what is known as traumatic toxic stress. Traumatic toxic stress caused by constant negative environments lead to sustained stress response system activation. In other words, you're in a constant state of anxiety. According to Ora, the main regions affected by traumatic toxic stress is the hippocampus, the prefrontal cortex, and the amygdala, the main areas for emotion and behavioral regulation. In conclusion, there is huge vulnerability of external stimuli to be able to mentally, behaviorally regulate themselves, which will lead to adverse outcomes such as substance misuse. The image on the right is a diagram of the developing brain. To put it simply, at age 12, we are still growing. In the first brain, the large areas of green represents the less developed areas. If exposed to adverse outcomes such as trauma, you are largely impairing your brain's development and neuronal connections. The last brain is more blue, which represents the more developed areas. It is scientifically proven that the brain is less vulnerable to permanent damage after age 20. Ramos Olazagasti collected data on adverse childhood experiences in Puerto Rican youth that resided in San Juan, the island's capital. They found a very high proportion of children that reported any adverse experiences, with an outstanding 87%, and these adversities tended to co-occur. This fact opens the probability to encounter huge results for their research on multiple adverse childhood experiences, which discusses that individuals who had at least 4 ACEs are more than twice as likely to be current smokers or heavy drinkers and almost 6 times as likely to drink problematically than those who have no ACEs. Furthermore, Carino's data about psychiatric illness comparison between in-island Puerto Ricans to U.S. mainland proved that there was statistically significant evidence that island Puerto Ricans had higher rates of substance disorder, at 7.8% versus 4.6%. This difference is apparent for both any alcohol and any psychoactive drug disorder. As mentioned before, our population of interest are Puerto Rican college students that grew up in the island. The participant must be older than 18 years old. In order to collect the data we need, we identified the socio-demographic variables in 3 possible questionnaires. The socio-demographic information we will collect includes age, gender, and socioeconomic status, such as level of education and household income. Next, the following questionnaires reproduce the methodology used by Forster. The first questionnaire about adverse childhood experiences is the one developed by Felitti in their ACE study. All questions start with the phrase, prior to the age of 18. As Forster, we will use the American College Health Association National College Health Assessment, which takes on a broad spectrum of topics in order to create a general college student profile. This survey includes alcohol, tobacco, and other drug use, sexual health, weight, nutrition, exercise, mental health, personal safety, and violence. Lastly, we wanted to assess the frequency and severity of drinking, similar to Forster. However, we were also interested with Cayetano's highlight on alcohol use disorders in Puerto Rico. That is why we decided to use Bradley's Alcohol Use Disorder Identification Test, or by its known acronym, the AUDIT-C, which McCabe used in their studies about alcohol use disorders in Hispanic college students. Our study's predictions are based on Forster et al.'s findings in their ACE study. Firstly, in Forster's sample, non-Hispanic whites and Asian students reported lower ACEs. That is why we will be observing an elevated report of adverse childhood experiences in our Hispanic sample. Secondly, Forster discovered that Hispanics had the highest odd for engaging in drinking and polysubstance use in comparison to their peers. We predict that we will be observing a similar trend in our sample. Third, we will be seeing a correlation of high adverse childhood experiences and an increased odds of drinking in Hispanics. These results exceed the data collected from non-Hispanic white peers, even though they reflect similar alcohol use patterns, according to Forster et al. The following graphs are from Forster's study, and these represent a correlation of the type of ACE exposure with the type of substance the students used. The graph to the left reports the substances used in the past 30 days, while the graph on the right represents substance-related behaviors in the past year. In both graphs, we see that students who underwent sexual abuse will have the highest prevalence of alcohol and drinking. Also, almost all reported adverse childhood experiences are correlated to some degree to alcohol use, with exception to parental IPV, which is an acronym for Parental Intimate Partner Violence, and verbal abuse in the past 30 days graph. We conclude this presentation reflecting on Oral et al.'s citation about how the high population prevalence of adverse childhood experiences and their association with a wide variety of negative outcomes support the need to prioritize trauma prevention. Oral's paper includes a strategy for change that could be applied to the Puerto Rican context. The primary goal should be efforts to prevent ACEs so that children grow up with less exposure to adversity. It is a call for action in the present. Moreover, if we succeed, these children are less likely to have children of their own who experience trauma. As a secondary prevention method, Oral et al. Highlights the importance of reducing short-term and long-term consequences when the child already experienced adversity. Now we're looking at the change we could make for the children that were exposed as an effort to minimize the negative outcomes. Thank you for your attention. I wish you a happy holidays. Take care and stay safe.